is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're very pleased to welcome back to the program Annette Whittemore, founder and president of the Whittemore Peterson Institute. Pleasure to have you here.
Thank you.
And Dr. Judy Mikovits, who is the research director for that same organization. Pleasure to have you both on the program. Annette, can we just start out with just a really brief, simple explanation of what neuroimmune diseases are, including ME and CFS?
Well, they're systemic diseases, and they impact both the nervous system and the immune system. ME/CFS is a very, very complex disease, and we believe that it is infectious, that there are many organisms involved, and that it's going to require quite a comprehensive set of treatments in order to bring about change.
The retrovirus XRMV that had shown up in research on prostate cancer was found, according to your research, to be in the majority of tests done on folks not only suffering from ME/CFS but also prostate cancer, correct?
Yes, correct, yes.
And what has been the result in terms of the worldwide reaction to this?
Well, we've had a really exciting year. We've had interactions with countries including Norway, Spain, Belgium, different groups throughout the U.S., in the southeast and in the northeast. So many groups are into the research, excited about the research, and actually detecting XMRV in their patient populations.
4 papers were published this week in the journal Retrobiology, and according to the Wall Street Journal, demonstrated, according to the authors, how easy it is for mouse contamination to skew lab tests involving XMRV. I'm very excited about this, to get this right. Give us your thoughts on that, and
I'll let Judy speak to that, definitely.
Well, yes, I mean, we've shown in the paper that we published last year, and in a confirmation study done by Harvey Alter and Shai-Xing Lo at the NIH and FDA, that it's necessary to do multiple different kinds of tests, that one single test won't give you clear detection of XMRV, and because it's so closely related to some mouse viruses, it's very important not to work in a mouse lab and to actually isolate the virus and show an immune response in the patients to the virus. So multiple tests are the way to detect the virus, and we were well aware that it was easy to have contamination potentially skew the results.
Were you surprised at the response to these papers?
I was. I thought that it was a well concerted effort by this group to make sure that everyone knew about it prior to our being able to have a response, and we really weren't notified and given that opportunity. So we wanted to thank you for this opportunity, really, to be able to respond and to pretty much calm everybody down and let them understand that it really doesn't change the findings, it doesn't change the work that we've done whatsoever, and that we're moving forward in a very positive way.
What do you think the motivation was behind this, that they didn't contact you, as you guys were the prime research center?
Well, it's difficult to comment on the motivation of others, but I think it is an attempt to make certain that you know, maybe that the patients aren't served, and that XMRV is not an important. I think there's a great fear about the public health risk of this virus in this disease and in cancers.
Okay, would you explain that a little bit more deeply there?
Mm-hmm. Well, if our results and the confirmatory results that were published in August of this year hold true, as many as 20 million Americans could be infected with a new human retrovirus of uncertain pathogenic potential. That means you don't have to get sick, but you might. So as many as 20 million Americans, and that's 20 times the amount of HIV that was in this country at the height of the HIV epidemic in 1995. So I think there's a great concern for the public health, and that's why everything that's published about XMRV gets great attention each time.
And one of the easiest ways for people to understand a retrovirus is AIDS, correct?
That's a good example, and then there is another one, HTLV1, and certainly looking at those viruses you can learn something, and they understand the retroviruses and how they integrate and so forth. But this is a brand new family, never found before in human beings, and so I think there's a lot to be learned, and before we make any clear statements, we want to do the good, hard research, and we certainly, I am very, very proud of our group and the fact that they didn't take their first results, and simply go with those, but really looked very, very long and hard at this and took 4 different methods to just be absolutely sure they knew what they found.
Whenever there's a discovery like this, and this is a huge discovery, and out of Reno, Nevada, which is wonderful, but there's always going to be a huge fight in the medical community when you have these kind of changes, correct?
Oh, absolutely. It is a huge discovery, and as I said, of potential public health high significance. So it's always going to be a level of understanding. We all have to learn how to detect the virus, what to study. There's just a lot of that has to be learned. So there's always going to be a lot of pushback because, of course, the best science generates more questions than answers, and that's certainly what's happened here.
Okay, let's take a break. More on this topic when we come back.
To contact Nevada Newsmakers, call 775-857-2244 or go to NevadaNewsmakers.com. And now, back to Nevada Newsmakers with Sam Shad.
And back on Nevada Newsmakers, we continue our conversation with Annette Whittemore and Dr. Judy Mikovits from the Whittemore Peterson Institute. Your researchers have published in the past year that the reasons that other scientists around the world have had trouble recreating the results is that they're not doing the research in the same way. Why not? That just seems to be illogical. Why are they not doing the research in the same way?
Well, you know, scientists usually do the things that they do well, and the advances that we've had in the past decade or so in molecular testing, that is high throughput, lots of samples, very quickly with an instrument to measure is it there or not, have really replaced the old-fashioned way of culturing. It's very difficult to culture virus, develop antibody testing, which we've done, and it takes a lot of time and significant resources. So it's the hope and perhaps the bias of other researchers that since we can detect HIV with these what's called nucleic acid testing, we should be able to detect this virus, and that's just not the case at this point. It's too early in the discovery process, so we must do the labor-intensive isolation of virus from the patients, and that's very difficult.
I was just going to make one other comment, and I think it got glossed over in these last papers, but really what you're talking about are researchers at the NIH that have done this work, the Cleveland Clinic, the University of Utah, Cornell University, and the WPI. So there certainly are others out there that are very, very successful at this and are moving their research forward as well. So we're lucky to have those significant groups of researchers working on this.
What's the role of politics in all of this?
Well, you know, there certainly is a lot of politics in medicine and science.
It's a big deal.
And I think whenever there is money, whenever there's prestige, whenever there's power, whenever there's change, there's going to be a lot of interest. And certainly in this case, there's a lot of money involved. Basically, you have pharmaceutical companies, you have insurance companies, disability companies, you even have government-run healthcare systems, and they all have a stake in this. So it's going to create a massive change in the way things are done, the way these people are treated, and it's going to cost. And so I think the pushback right now it can be related to political issues.
The blood supply around the world. I mean, people go in and give blood, but they're not being tested for this at this point.
Well, actually,
is that changing?
They're not being tested because we haven't been able to develop those tests. So the papers this week were were attempts to develop that high throughput fast test that's needed to check the blood supply. You can't do it the way we do it right now. So what we've learned, we've been working with the National Institutes of Heart, Lung, and Blood and the various blood working group that was set up the day the paper was published last year, and we had a successful meeting at it's called the Blood Products Advisory Council last week in Bethesda, Maryland, and what was decided there and voted on was there was enough concern and enough data to suggest that CFS patients not donate blood, that until we can learn more, a question is asked, if you've ever had CFS, you're not permitted to give blood at this time. So in light of new discoveries, we're erring on the side of caution and working very hard to develop those tests.
People can actually be tested for XMRV right now, correct?
Yes,
through
they
the
can.
Institute.
Yes.
And they just get a hold of the Institute through your website?
Actually, the clinical laboratory is called VIPDX, and they can go to that website and learn more about the test. So ours is a research lab at the WPI, and the clinical laboratory is getting ready to open in the WPI, but we're not yet set up. So VIPDX is the current laboratory, and they are doing testing. If a physician orders that test for a patient, they will get that test.
Yeah, and we culture virus and determine if the patient has an antibody to the virus, and that is the gold standard assay. It takes time. It may be as long as 45 days. So, but we're not in a hurry. The key is to get the answer right.
Since the Institute opened earlier this year, how have the functions of the Institute been going? And it's based on the campus of University of Nevada.
It is. We're very, very excited. It took a little bit longer to get in than we had thought initially, but we're in. We're up and running. We have been working very, very closely with a physician, came to town for an entire week this past week to help us set up the medical practice. Meanwhile, getting all the instrumentation up and running in the research laboratory has taken some time. That's all going smoothly now, and so we're very excited, and anyone that wants to come by certainly can come by and see what's happening there, and we're very, very proud of it. We're certainly excited to have all of the pieces in one home.
So I guess bottom line from this entire discussion today is for people not to panic, that things are still moving forward, that nothing has changed. It's just that there are differing opinions.
Absolutely.
As one would expect, and this is really a great time of hope, because we've also determined in our research this year, and that'll be coming out published very soon, we're understanding why the virus hurts the immune system. We're understanding what's going wrong to make you sick, and that's another first step in order to just start making people well. So it's really a great time of excitement and research around the world, and we expect treatments next year.
2011. Can't
Yes.
wait. All right. Thank you, ladies, both, for being here. We really appreciate it. More to come on this topic. We'll be right back in Nevada Newsmakers after this timeout.